welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, as you know, since we started this program over almost 6 years ago, can you imagine? Since we started this program, our goal has been to educate the layperson. You, the man on the streets, the one who doesn't know much about health or medicine, about the things that you need to do as a Black person and also as a Nigerian to take care of your health and that of your families. What you need to avoid, what you need to eat, how you need to sleep, how you need to move your body, and of course, medications and so on, and what they do for your health, and how to interact with your doctor. However, it is not enough just to do those things because the government has a role to play in your health. Everything from sanitation to good, clean water, to availability of vaccines, to availability of antibiotics and good hospitals and good specialists who can attend to you. Those are all very, very important. That is why I am super excited about our show today, because we have one of the very top people who is here to talk to us by name of Dr. Tunji Alausa, who is the Honorable Minister of State for Health. Welcome to the show, sir.
Thank you, David. I'm happy to be on your show today.
Thank you so much for making the time. I know you're very, very, very busy, so we're going to get right into it. We have a few things we want to talk about, including vaccines, Lassa fever, your HOPE agenda, and so on. But before we get into that, first of all, I'm looking at your resume and your background, and I see the contributions. You're a nephrologist by training and specialty. You've contributed hugely to the field. You are extremely accomplished, extremely well taken care of. Why, I know I'm not just speaking for myself, but for our viewers as well, why would you put all that at risk and go into government work knowing that not sure whether things would work or not? Why would you do that?
Very good question. Two singular reasons: to serve humanity and to come in and work for this President Bola Ahmed Tinubu, who has spent a larger part of his life fighting for every single citizen of Nigeria. He wants the best for Nigerians. He's led almost his entire life. It's a passion for him. You saw what he did as the governor of Lagos State. Now, as the president of Nigeria, as the president of the Federal Republic of Nigeria, President Bola Tinubu is on a journey to completely overhaul every single sector of our economy into the future in a sustainable manner, where every single citizen of Nigeria will enjoy prosperity, quality health care, good education, opportunity, rule of law, improved security, and when corruption will be at the barest minimum. This I can do in my journey in life today is to come work for this president, come serve this president, and then serve Nigeria based on his instructions.
Fantastic. Wow. Well, I really wish you the help in all that, because as we know, this health in particular is a very uphill task, considering the challenges ahead of us. And we're going to talk about the challenges a little bit. But I'm seeing here renewed HOPE agenda. Can you talk to us about that?
Thank you so much. That's the renewed agenda. That's the campaign campaign manifesto. That's the benchmark, the linchpin of President Bola Ahmed Tinubu campaign manifesto. Renewed, and I can tell you today, renewed hope is real. We're all witnessing renewed hope in our country. The president came up with eight big agenda on his renewed hope manifesto. From how it would improve food security, national security, give opportunities to women, bring accountability, rule of law to our country. We're beginning to witness fruits of the President Bola Ahmed Tinubu promise, his promises to the country, his campaign promises, and he's been working so hard to meet these promises. And I can tell you, in the Ministry of Health, in the health sector, that we have a president that is passionately and determined, and is very passionate and very determined and very deliberative in ensuring that every single Nigerian enjoy meaningful and comprehensive healthcare. It is meeting its campaign promises with actions. It's supporting us, giving us everything we need at the Ministry of Health. Myself and Honorable Mr. Pate, as its Presidential Minister, the President has told us that everything we need, we'll get. And we've set out our own 4-pillar agenda on how we're going to rejig, overhaul, and improve the entire healthcare system in Nigeria in a sustainable way. And this agenda latches on Mr. President renewed hope 9-point agenda. The first pillar of agenda is improving governance. Governance, holding ourselves as health providers accountable in the kind of care we deliver to our citizens. Holding our health institutions accountable in the kind of care they deliver to our citizens. And even the way we talk to our patients, the way we talk to ourselves as professionals. And now we have a big part, we're giving big part of citizen engagement. Citizens are being encouraged to be more proactive in their care, to let us know the quality of care we're delivering to them and how we can improve on those care, on the quality of care. That's our number 1 pillar. A second pillar is improving our population outcomes. How do we improve our population outcomes? We're investing more in improving infrastructures, in our hospitals, in our primary care centers. We're equipping them with modern equipment. The President has been kind enough to give us significant increase in the budgetary allocation to the Ministry of Health. This 2024 budget has the highest budgetary allocation to healthcare in the last several decades. Wow. I know we're not at the 15% Abuja declaration yet, but from where we're starting today with this 2024 budgetary allocation, we're really on the right path. We have enough money to spend. We don't have everything that we need, but we have substantial amount of money to spend in upgrading our primary care centers, our tertiary hospitals, modernize them with equipment, buy more consumable. And as you've heard, the President has also approved the construction of 6 new cancer centers in each 6 geopolitical zones in the country, has also approved the building of 9 ultra-modern diagnostic centers scattered all around the country. These are all the things we're doing. These are some of the things we're doing to improve our population health outcomes in the country. And the third pillar of agenda is unlocking the value chain of our healthcare system. We need to move our healthcare sector as a consuming part of the economy, but to be a growth part of the economy. We want the healthcare sector to contribute to our GDP. You go to some democracies. In the United States, for example, healthcare contributes about 24.5% of the GDP, of American economic GDP, which translates to about $3.3 trillion. Now, we need to do the same thing here. Today, healthcare as a contributor to our GDP is less than 5%. As we unlock the value chain of our healthcare sector, we would bring more manufacturing to the country in areas of diagnostics, in areas of vaccine production, in areas of medical consumable production, even medical device production. And as we do that, we'll create hundreds of thousands of jobs, good job, well-paying job to young Nigerians, males and females. Give them the opportunity to unleash their innate potential and lead a good quality life. We are hoping that as we do this, we'll get healthcare year over year, increase the contribution of healthcare to our GDP year over year, and in the next few years, get healthcare to contribute up to 15% of our GDP. And the last pillar, which is looking at health beyond physical security, but also as part of our social security and national security.
That's amazing. We're going to come back to that because I have some specific questions, but at this point we have to take a quick short break. So don't go away, folks. We'll be right back. All right, welcome back, folks. I am here with the Minister of State for Health, Dr. Tunji Alausa, and he's laying out the federal government, Mr. President's plan to revamp, rejig, to transform healthcare in Nigeria. And I'm excited about some of the things he's talking about. I mean, I have a few questions about whether it's going to be possible in 10 years or 20 years. I'm just being real here. But we definitely want to dive in deeper into some of these things that you're talking about. So there are 4 pillars. One of the things you have said, sir, is that we're giving it more access to the citizens of Nigeria so that they can reach and they can share their issues and get feedback. Did I hear that properly, sir?
Yes, that's part of our citizen engagement agenda. We're opening up
a little bit about that, sir.
Okay, there are several ways we're doing this, and actually the president is doing that as well on a larger scale to the entire sector of the economy. I'll tell you a little bit about that, but let me focus on the healthcare sector. We are encouraging we're developing digital platforms where citizens can go, comment on the kind of care they're receiving in their hospitals, if it's good or bad, and give us solution. And even beyond giving us solution, we are reviewing this on regular basis to see what we need to improve on. We actually initially, as part of our diagnostics when we came in, we did patient opinion sampling around the country. We went to about 5 or 7 states, capital states. We asked people to tell us what they feel about Nigerian healthcare sector today. Not all good news, but we're very happy that citizens actually pour their heart out to us on how exactly they felt at that point. Now, and we've made promise that by the time we do the second sampling, patient opinion sampling, we would have made significant improvement because we've put a lot of things in place. Now we put a standard and regulatory commission committee in place that is going to a federal tertiary hospital, ensuring certain standards are being met. And we've also working more collaboratively with our regulatory agencies in the way they go to us, in the way they certify our hospitals. So we're doing more education with our staff at the hospitals and the medical directors and the chief medical director of hospitals. We've created a robust education for them on how to improve on their patient care service delivery. Now, I told you that the president also has a big agenda for citizen engagement. The president has appointed a very smart lady as a special advisor on policy coordination. They've developed a public portal on where Nigerians can go. That portal, that app has been recently launched a few weeks ago on where citizens of Nigerians can go to give their opinion about the government and give their opinion on every sector of this government.
Okay, fantastic. All right. So when we now talk about apps, we talk about access and all that. But I also want us to talk about those in remote areas, because when you start talking about apps and technology, we know that the people in remote areas may not have access to that, and they need healthcare too. And most of Nigerians are, out of the major cities, for instance. So how does this help the little guy, the man in the remote areas, in the villages? And of course, number 2, that's the second question on that, is insurance. We know that most Nigerians are not insured. So how can they get access to healthcare if they are not insured like they should be? So those are the 2 questions I have for you based on that, sir.
Yeah, there are two questions. I'll just repeat them out. How do we carry along the entire population of Nigeria in both rural and urban as we move ahead to improving, revitalizing, rejigging, overhauling our healthcare system in the country? And then what are we doing to create more access for patients to have insurance? With regard to getting healthcare to the community, we have a One Health approach. We're running a whole of society approach, all of a government approach. This government, we're just not working on tertiary level. We're also immediately working on a primary care level as well. We have a basic healthcare provision fund, which is 1% of the consolidated revenue. We have about 125 billion in this 2024 budget. Now, this has the basic health provision fund has 3 gateways. 45% of that fund goes to the primary care centers. 45% goes to the national health insurance gateway, and the additional 5% goes into emergency services. With the provision, the ones that goes into the primary care gateway, I'm sure you've heard about a swap program, a compact program that was signed with the governors and our development partners. Before we came in, there's a lot of hyper-fragmentation in the way care is being delivered in our country, in the way funding is being allocated by our development partners. The good people, they're helping us to improve our healthcare delivery to our citizens. But then we've seen that as part of our diagnosis, we found this massive hyper-fragmentation. Now, with our swap program, we're now coordinating more and better with our development partners so that we can pull more funds to where it's needed the most. And some of our development partners that do not want to pull with us, we are aligning with them to direct where those funding should go. So what we now have we have a pool fund from our development partners, which we're adding to our basic healthcare provision fund, and we're directing these funds. More funds are now going to go to our primary healthcare centers, where they can have more money to improve on their manpower, hire more manpower, improve on their service delivery, buy more commodities, buy things that they need, improve their PACs, get power, solar power, and we're also working on a digital in health, which is a big other program, get them digitalize our healthcare delivery at that level as well. So as we move along, we're delivering better care to our citizens at the rural level, as we also improve infrastructure and equip our tertiary hospitals better. And also we're working closely with our sub-national government to also get them to improve this on the infrastructure, to improve their infrastructures at the secondary level, improve infrastructure at the general hospital at the state. So it's a whole of a government approach, a whole of a society approach that we're using. We're coordinating better. And as we do this, it will translate into one thing: delivery of care to our people, which will then lead directly to improve outcome. Now, as part of what we're doing as well, as part of our SWAP program, we're retraining 120,000 frontline workers. That started now, and these are frontline workers at the primary care at the primary healthcare centers. I think I've addressed the question of how we're improving on care delivery to our rural community. We're doing that very proactively and in an aggressive manner. With regards to improving access to insurance coverage as well, we've just appointed a new Director General to head the National Insurance Agency. It's put together a strategic plan to improve coverage from current level of 7 million to about 50 million people that will be covered in the next 4 years. And the way that's going to be done, we've also increased funding allocation to our National Insurance Gateway from the Basic Healthcare Provision Fund and also from Pool Fund from our development partners. And as well, we're also working closely with the State Health Insurance Agency, where we now have more fiduciary, more financial accountability at those state level. Funds that will be allocated to them will be better managed and better policed. We have, if you've recently heard, the president just announced approved for us to have President Bola Ahmed Tinubu fellows. Those are fellows that will go, there'll be each fellow at each local government level. They will go and monitor the way the increased funding that is being delivered to our primary care centers and state health insurance agencies are being used. And also those state health insurance agencies are now going to be compelled, they'll be made to give returns of how funds that have been allocated to them have been spent before they get the next tranche of allocation. So we've improved fiduciary. We're improving fiduciary services at this level, at all levels. Also, we're also going to rework the way our private HMOs are working so that we can get them to aggregate so that we can begin to deliver better services and enroll more people at more affordable price to our citizens.
That's fantastic, sir, because I remember you once, I think I checked the numbers, is like currently about 7% of Nigerians are insured, and your goal is to increase that to, did you say?
No, 7% of Nigerians are insured, and I think
7 million, sorry.
7 million, 7 million, so not 7%, 7 million.
7 million.
We want to get to about 50 million people within the next 4 years.
Okay, wow, that's huge. Okay, we have a few minutes left, but I certainly don't want us to end this without covering just a few things. Like, for instance, this whole problem with organ transplant and organ stealing of organs by the population, and Lassa fever. I know we're going to have to wrap this up really quickly, but can you talk to us about what you're doing to curtail this organ harvesting? It's illegal organ harvesting that's going on in the country right now.
Yes, I'll try and take both the two questions you talk about, illegal organ harvesting and the Lassa fever. Now, illegal organ harvesting, it's illegal. That's why it's illegal. I need to talk directly to these bad actors. What you're doing, it's wrong. It's inhumane, it's inhumane, it's immoral. You can't be exploiting young men and girls to harvest the organ, to sell the organs to you. You will face the full brunt of the law. And what we've done, I know you've got there, you must have heard about a video that got viral about some illegal organ harvesting that was being done here in the capital city, Abuja, where we've worked with the Office of Inspector General of Police. The Inspector General of Police has been kind to us. He's given us some of his brightest criminal investigative officer. We're working with them. In fact, some of these players, some of these bad actors have been arraigned already. They've been taken to court, and we're working to get conviction. They will face the full brunt of the law. We're also we're working with a regulatory, licensing authority, the Medical and Dental Council of Nigeria. They've started investigations on the professionals that are involved here. Their licenses, some of their licenses have been suspended. And if once the case has been proven, because we're a country where government believe in rule of law, we have to follow, irrespective that people have been accused. We also have to follow the rule of law to be sure that they're not wrongly accused. But the ones that are found wanting, professional, their license will be terminated to practice medicine in Nigeria. Also, we're also going to work on how we can better regulate our health facilities in the country. There's a void here in regulation, and that's why some hospitals can engage in this bad behavior. And I think the hospital that has been identified where this illegal organ harvesting occurred, I think we're also taking action to sanction that hospital. And now, that's just an isolated incident. We're also improving education so that to talk to young Nigerians that they should not sell their organs. They're putting their own life, their own health at risk. And we're going to do more. As we do more education, we're also going to do more surveillance of these bad actors so that we can proactively break that cartel and bring those people behind it to justice. Fantastic. Now, with regards to Lassa fever, Lassa fever is a zoonotic infection. Now, it used to be seasonal before, but we're seeing it more earlier into the season. And we had the Lassa fever births before. But now, there are more states that are being involved, that are being affected now. With the federal government, via the Ministry of Health, we're collaborating more with our state government to support them in areas of medical consumable that they need to take care of patients that have Lassa fever. We're providing them PPE, we're providing them therapeutics, medicine they need to use to treat. We're also helping them to set up and equip molecular laboratories around the country. So where we sort of in the state where we have most of this prevalence of Lassa fever, so that they can quickly diagnose and treat patients with Lassa fever. And beyond that, we're also working on developing mRNA-based Lassa fever vaccine, so that we can have a complete two-fair of care and prevent, vaccinate, so that we can actually prevent rather than treating into the future. And we're also working on improving on our public health emergency operation centers, where we can begin to collect more data, get those data in more of a real time, so that we can intervene more and in a much quicker fashion.
Fantastic. Well, sir, it seems you have a lot of things that you're doing in the next 3 years, 3 or so years, and you have the full backing of Mr. President. And I love the fact that you have a detailed plan and that you are beginning to execute along with the checks and balances, because that is so important, especially in a country like ours. I want to wish you all the best absolute success in achieving all these goals, and I'm sure we will be seeing you again soon to talk about how things are going on with these goals, these lofty goals, I must say, that you put in place. So thank you so much for your time today, sir.
Thank you, David, and best of luck.
So that was the Minister of State for Health, Dr. Tunji Alausa. The recording will be on our website and of course on the NTA website. Remember, your health is in your hands. Be sure to focus on understanding how to improve your health on a daily basis, and that's what we're here for. God bless, take care, see you next week. Bye.